Introduction to Adult Social Care. Introduction to the module. Adult social care is a broad word that refers to the assistance offered by a variety of organisations and individuals to enable those in need to preserve their independence and well-being. People may require social care services owing to a variety of reasons, including mental health issues, learning difficulties, or physical limitations. This module covers the key aspects of adult social care, the history of adult social care, and the major crises in the sector of adult social care. Additionally, it covers the gross value added, GVA, and the impact of indirect and induced effects on the economy. Learning objectives. By the end of this module, you will be able to explain the key concepts of health and social care and their differences. Describe the history of adult social care. Identify crises that shaped reforms in the sector. Explore the GVA contributions of adult social care. Discuss the impact of indirect and induced effects within the sector. Introduction to health and social care. Healthcare refers to the services available to you to maintain and improve your health. A healthcare need involves treating, controlling, or preventing a disease, illness, accident, or disability, as well as providing care or aftercare for individuals with these requirements. The NHS provides free healthcare services to UK people. Social care means to give services if you require practical assistance and support due to an illness, disability, or age. Your local authority provides social care services, which you may be required to pay for. A social care need focuses on providing assistance with daily living activities, maintaining independence, and social interaction, allowing the individual to participate more fully in society, protecting them in vulnerable situations, assisting them in managing complex relationships, and, when necessary, access to care homes or supported accommodations. History of adult social care. The term adult social care was adopted in response to decisions about children's services and related organisational changes, and it was not linked to any major new policies, plans, or specific new programmes. This meant that advances and changes in adult social care drew on and arose from existing patterns and trends. The 1968 CBOM report recommended unified local authority social services, leading to the 1970 Local Authority Social Services Act, which established comprehensive social services departments and a generic social worker approach. Across the UK, reforms emphasised residential care, but financial pressures shifted focus to home-based and community care. Economic crises and reduced public spending promoted voluntary sector involvement. Emerging community care models were driven by demographic trends, criticism of care, and a value-for-money agenda. Community care, initially focused on non-institutional support for people with mental illness, expanded to include domiciliary care, day care, supported housing, and independent living aids. The 1980s saw a shift from residential institutions to community-based care, though family and informal networks often bore the burden. The 1986 Audit Commission report criticised slow progress, resource mismatches, and financial incentives favouring residential care. In response, the 1988 Griffiths report called for reforms, highlighting the need for clearer responsibilities, better use of public funds, and a shift towards a mixed economy of care, promoting choice and efficiency. The UK government delayed responding to the Griffiths report, fearing local authority expansion. The Caring for People White Paper, 1989, outlined 6 community care objectives: promoting home-based services, supporting carers, improving assessments, encouraging independent sector involvement, clarifying agency roles, and introducing new funding structures. The NHS and Community Care Act, 1990, implemented most proposals, establishing a purchaser-provider split, strengthening user consultation, complaints procedures, and the Social Services Inspectorate. Carers gained rights to separate assessments and tailored support packages, with 85% of transitional funding directed to independent providers. Financial pressures forced local authorities to ration services, tighten eligibility, and reduce care packages. By the late 1990s, community care had fully transitioned to a quasi-market system, increasing the role of carers and prioritising cost-effectiveness over user needs. In 1997, the Labour government implemented modernising social services, focusing on outcomes for individuals and carers. The policy aimed to promote independence, safe living, employment, and support for informal carers. New Labour's approach was complex, focusing on partnership, stakeholder empowerment, and evidence-based policymaking. They continued previous Conservative policies, such as the mixed economy and contracting out services, and emphasised adult social services at the heart of the welfare state. In the 1980s and 1990s, discrimination and inequality in community care and social care became significant concerns. Racial discrimination and prejudice were analysed, and social care was seen as contributing to societal inequality. Anti-discrimination legislation and training in anti-discriminatory, anti-oppressive, and anti-racist practices impacted adult social care, with the social work profession taking responsibility. The crisis in adult social care. Adult social care encompasses social work, personal care, and practical assistance for adults with physical disabilities, learning disabilities, or physical or mental illnesses, as well as support for their caretakers. The majority of care is provided without compensation by family or friends. The Department of Health and Social Care, the department, is in charge of developing national policy and the legal framework. As people live longer lives, there is an increasing demand for care services. Age UK hears far too many stories of older people who are unable to access the services they require, receive poor quality care, or face exorbitant fees to pay for their care. In 2021, the Department of Health and Social Care announced a 10-year roadmap for adult social care reform, including a £5.4 billion investment. However, plans were amended in 2023, and no roadmap or objectives are in place after 2025. Another concern is a workforce shortage. The DHSC confronts a 10% vacancy rate in its industry, with 152,000 openings in March 2023. The PAC believes the workforce strategy is insufficient and raises worries about visa limits and exploitation threats, particularly in rural areas. The PAC is particularly concerned about the need for adult social care services in rural areas, which is expected to rise despite chronic understaffing in these places. Another major difficulty is short-term funding. The lack of multi-year financing agreements inhibits local authorities' ability to plan and implement long-term reforms, exacerbating the adult social care crisis. Gross value added, GVA, of adult social care. Estimates of regional gross value added GVA, which is the value generated by any unit engaged in the production of goods and services. GVA is significant because it serves as a crucial statistic for determining the overall success of the national economy. It is also used to determine the contribution of various sectors and areas to the national economy. The sector's response to the COVID-19 epidemic contributed to above-average growth of 5.5% each year. In 2019 to 20, adult social care accounted for 1.4% of England's total GVA, but this increased by £1.8 billion, 7.7%. In 2020 to 21, adult social care had a GVA of £25.6 billion, accounting for less than 1.6% of the entire GVA in England. Adult social care employs approximately 5% of the workforce in England. In addition to the direct GVA added to each local authority's economy, the indirect and induced effects total £12.5 billion and £12 billion, respectively. The minimum economic value of adult social care in 2020 to 21 was £50.3 billion. The adult social care sector is anticipated to contribute £68.1 billion in gross value added (GVA) to the English economy each year, increasing 13.2% from 2022 to 2023 and 13.5% in 2023 to 24. The economic contribution estimate also includes private sector profits, indirect effects, the adult social care sector's supply chain, and induced effects, money spent by adult social care workers. Indirect and induced effects. Indirect effects are those caused by the demand for intermediary goods and services required to offer adult social care services. For example, senior social care services require medical supplies, employee education and training, cleaning products and services, furniture and domestic goods, among other things. The adult social care sector also creates employment and value in other sectors due to the demand for intermediate goods and services, for example, medical supplies, to provide care. Induced are the impacts of changes in the purchasing patterns of persons who work in adult social care, both directly and indirectly. Individuals who are directly or indirectly engaged in the adult social care sector spend money, which generates more jobs and value in other industries. Adult social care generates employment and value in other sectors as a result of induced effects. Highlights from this module. From this module, you have learned the following points. Adult social care provides practical assistance and support to help individuals maintain their independence and well-being. Community care includes domiciliary care, day care, supported housing, and independent living aids to support people outside of residential institutions. In 2020 to 21, adult social care had a GVA of £25.6 billion, accounting for less than 1.6% of the entire GVA in England. Adult social care contributes significantly to the economy through direct GVA, indirect supply chain effects, and induced spending by workers. Indirect effects come from the supply chain for care services, while induced effects result from spending by care workers, boosting other sectors. Thank you. You have successfully made it to the end of this module.